Jarvis, thanks so much. Well, it's not just about grades, but also keeping kids healthy, and we know there are a lot of questions out there.
Oh, absolutely. And we are joined by Dr. James Feiste tonight from ANMed Health, live, of course. So thank you so much for being with us tonight, Doctor. Our first question for you. Districts say most COVID cases are being spread outside of schools. So what should parents or guardians be mindful of to really help stop the spread when students are not in school?
Well, as you can see, I'm wearing my mask tonight, and I think that's probably the most important message I can send. Is that seems to be the most important thing to prevent this from spreading. Is everyone needs to wear their masks, both the person and the people with them. A lot of the cases we've seen here at the office have always been associated with somebody not wearing a mask. I had one family saying, "Oh gosh, I wear my mask all the time," and then it turns out, well, my friends don't, and then they ended up testing positive. So I think that's the most important thing.
And we've seen the deadly case of a Miss C in the upstate, and I think when parents hear about this, some of them freak out, rightfully so. It's rare, but it's dangerous if it happens. What are some of the symptoms that parents need to look out for?
So just like everything else with COVID, it's really unpredictable. I mean, thankfully it's incredibly rare, but when it happens, it's tragic. What you'll see with it is it's usually after the illness, and so some of the kids will have recovered from COVID. Other kids will actually have had an asymptomatic and you didn't even know they were sick. And they come on very quickly. Typically the most common symptom of MIS is actually gastrointestinal. They'll develop very bad vomiting, severe abdominal pain, diarrhea. About half of kids will have fevers and a rash with it, and actually coughing is much less common in children than with adults.
Now the vaccine, as we know, has not been approved for those 16 and under. What is the current guidance for kids and the COVID vaccine, and is a child-approved version in the works at all?
So yeah, we're looking forward to getting a vaccine for kids. I'll tell you, we've been waiting with bated breath. I mean, right now the approval is 16 and above. I've actually started to see a couple of my patients who are older being able to get the vaccine because they're taking care of younger siblings with special needs. I know that there is ongoing studies right now in children down as young as age 5, maybe even younger, and I'm hopeful that we're going to see a vaccine later this summer.
All right, well, Dr. Feiste, thanks so much for staying up with us tonight and joining us here for this special, and hopefully we'll have you back on here soon to answer some more questions.
Yes, thank you, Doctor.
Absolutely.